and good day. It is Dr. McElwain with your first week's CATS. Just wanted to give you an update. As far as thinking of where are we now, America and drugs, I've placed a few videos there for you to be able to review. But the main thing is that we're going to be explaining your thoughts on the need or the great demand for substance abuse professionals in human services, psychiatry, and counseling in the next 10 to 20 years. And I say that, or I ask that question because I want you to really think long and hard at where we came from versus where we currently are now. And I always tell individuals to go all the way back when you're thinking about, finding out about, drugs and then learning about, not using drugs, kind of what we went through in the 80s and 90s. And of course, what they went through back in the 60s and 70s. Heroin came on the rise in the 60s and 70s, in the 80s, into late 80s, 90s. We started hearing more about crack cocaine becoming, wildly popular, as well as the cocaine era was definitely still happening as well. But a lot of street drugs that have come about. And then we started moving into the 2000s and we start looking at some of the other drugs that have come on the market. We're looking at things like fentanyl. Of course, heroin has made its comeback. We talk about marijuana and the changes we've seen over the years with marijuana. I mean, we've seen major progress in that area. So the reason for the question is basically wanting you to think a little bit deeper and go a little bit more in detail as to, what would it look like in, let's say, 5, 10, 20, 25, 30 years from now? Why would it be such a great demand for us to have substance abuse counselors, human services individuals, psychiatric providers that are all dealing in the area of substance abuse? So that's a main question for us. And like I said, you're going to see the videos that I have attached. But I just wanted to have a conversation where you guys can hear, some of the concerns and some of the things that, could come up. I mean, again, like I said, the war on drugs, that's caused a whole lot of things. You know, don't use drugs. Those have been campaigns that have come out of the government towards substance use. So there are a lot of different things. I mean, we can also talk about substance use as far as tobacco, and everyone remember the tobacco era when tobacco companies were being sued, and a lot of stuff was happening during that time. I believe that was in the 80s and 90s when a lot of that was going on. The 2000s. So just thinking and considering it all and taking it all in. Just realizing that and then let's go back to tobacco right quick. Now, a lot of our younger individuals, they're not necessarily using cigarettes. They're actually using vapes. So they're vaping now, and they can vape all kind of different substances in these vape devices that they have. Or, so a lot of times when we are thinking about how things have changed and where things are going to be going, there's a lot there. So I want you guys to just dig deep and really think. And again, look at the videos and see what you come up with. But yes, I mean, of course, myself, I can agree that there will be a lot of providers that will be needed in the years to come when it comes down to substance use disorders and individuals having a whole lot of psychiatric different needs as well with those substance use disorders, because we have so many substance induced type diagnoses that people go into psychosis because of the substance that they were using that had something laced in it, or the substance they were using, wasn't it was a bad batch, or whatever the case may be. And we do see things come out of it. So just wanted to put that out there so that everyone can get an idea for what we're looking for. And of course, when we look at the different questions that we do have for section 1, talking about the various theories of addiction. That's going to be some information from your textbook, of course, but picking two of those theories and kind of, let us know what stood out to you. So that would be your topic one, discussion question one. So that is something to really give you some more idea also as to, okay, so how would I be able to work with an individual if, there are some theories that I can use, and what can I incorporate in them that will help me to have a successful treatment plan for this individual. And then as we look at that one, given some good answers or some good follow-ups there, that would be the best way of going ahead and getting us some good answers out there. And then topic one, discussion question two, is actually going into more so um, talking about basically past approaches to aid the prevention of addiction, and current policies now that are influencing prevention programs for the most part, and then defining the terms of addiction and substance use disorder. Also is asking that you identify a current policy being taken in your state to help those struggling with addiction. So being able to do some state research as in what's happening in your state, your town, on the local level, on the state level, even if you have a regional level, I'll accept that as well. But just kind of knowing what's happening in the community and what's out there to help support individuals to remain to get clean, remain clean, and the prevention programs that are out there to make sure that individuals are actually addressing and focusing on, when they're not yet at the point of addiction, but they are teetering on that line. So, in answering and doing your discussion questions for week one, just want you to really think about things. Definitely use your textbook, look up videos. I always tell everyone, if you see some of the, for the first discussion question, if you see some of the different theories, you can also look those theories up. Sometimes there are some individuals that have done maybe some YouTube videos on a theory. And also, there are also some videos where people actually kind of do a mock session, clinical session, where they're actually looking at the theory itself, and then doing a session along the lines of utilizing that theory. So that's also something that you guys want to look for, and just kind of, help round out your experience. So I wanted to make this recording so that you guys would feel like you're getting a little bit more feedback with the discussion questions. And as you're moving forward, I will be making sure that I get a discussion, basically a discussion overview, or just some more information like I've done in this video, just so that you'll be able to hear a lot of different things about what's going on in the community, what's going on, around substance use, what's going on around prevention and things like that. So every week I'm going to be putting out a video so that you'll be able to kind of get some little tidbits here and there, hopefully some golden nuggets here and there, and be able to move forward and answer discussion questions, and definitely be a individual that can be able to add to our discussion and be able to follow up with your peers and ask questions if you have those questions. Look forward to working with each and every one of you. Thank you.